How can someone have HIV without having AIDS? First of all, HIV does not immediately progress to AIDS. Normally, HIV progresses slowly after infection. It may take many years, like 5 to 10 years or more, for AIDS to develop. At this stage, what people have is HIV and not AIDS. Most people with HIV are in clinical latency stage of HIV infection. This clinical latency stage of HIV infection is also known as chronic or asymptomatic stage. Here, people may feel normal and look healthy. HIV is still present, but the immune damage is made. CD4 cells above the AIDS level. In this stage, what people have is HIV and not AIDS, because the immune system damage is made. It has not become severely damaged. What's more, there is effect of antiretroviral therapy, which is stop the progression of HIV to AIDS. This antiretroviral therapy stop HIV replication and control the rate of mutation of this virus HIV. Like I told you before, this virus HIV is very good in multiplication and mutation. The work of this antiretroviral therapy is just to minimize this multiplication and mutation rate of the virus, so that the virus will not destroy CD4 cell till lymphocytes further. So by stopping the destruction of CD4 T lymphocytes, the immune system is being protected. So without this antiretroviral therapy, the immune system will continue to be damaged, which will mark the progression to AIDS. With proper management and treatment, many people never progress to AIDS. So life expectancy is possible. That is why it's very important to adhere to your medication and comply to your doctor's prescription. You ought not to miss your medication. If you are HIV patient, follow the guide given to you, the way you're supposed to take the drug. If it is daily, make sure you take your drug daily, so that the virus will not multiply further and will not damage your immune system. And when your immune system damaged, you know what will happen. Opportunistic infection, many diseases will tend to occur. That is the importance of adhering to your medication. When HIV becomes AIDS, a person with HIV is diagnosed with AIDS if any one of the following occurs. One is very low CD4 positive cell count. If CD4 positive cell count is below 200 cells per millimeter cube, AIDS is suspected. CD4 positive means cluster of differentiation for positive cell count. That is what I mean. 2 is presence of AIDS-defining illness, such as manifestation of opportunistic infection, certain cancers, frequent infections due to damaged immune system or weak immunity. This condition defines AIDS, not just HIV alone. So if you have any of these symptoms, meet your qualified healthcare professional or provider to ascertain your health. Having HIV does not mean you have AIDS, but AIDS cannot occur without HIV. HIV can be controlled, but AIDS indicates severe immune damage. With testing and proper treatment, HIV can be stopped from progressing to AIDS. A person can have HIV without AIDS because AIDS is the advanced stage of untreated HIV infection. Let me clarify more. All people with AIDS have HIV, but not all people with HIV have AIDS. That's simple. Signs and symptoms of HIV/AIDS. These symptoms depend on the stages of HIV infection. For instance, in early stage of HIV infection, that is acute stage, the symptom may appear 2 to 4 weeks after infection, while some people may not show those symptoms. These are possible symptoms that will occur in first stage of HIV infection, that is primary stage. There is fever, elevated body temperature, sore throat, skin rashes, swollen lymph node in the groin, neck, and armpit, body weakness, tiredness, or fatigue, headache also. These are symptoms that occur in primary stage of HIV infection. So these symptoms in primary stage are mild and often mistaken for flu and malaria. In the latency stage or chronic stage or asymptomatic stage, that is the second stage of HIV infection, it lasts for many years with few or no symptoms, but the possible symptoms are persistent swollen lymph node, mid-weight loss, recurrent minor infection, occasional fever and night sweat. Here, the person may look and feel heady, but the virus is still active. In the advanced stage of HIV infection, which is AIDS, that is the last stage, the signs and symptoms emerge as a result of immune system severely damaged. These signs and symptoms are severe weight loss, persistent and severe infection, skin or mouth sore, certain cancer like Kaposi sarcoma, chronic diarrhea, persistent fever and night sweat, extreme fatigue. There are other symptoms. We also have persistent cough. So, acquired immunodeficiency syndrome (ACE) is caused by untreated HIV or poorly treated HIV. Normally, HIV progresses slowly, not suddenly. With proper treatment, people never reach AIDS. That is why I encourage you to stick to your medication. If you are supposed to take your medication every day, try to comply to your doctor's prescription. Try not to miss your medication. This is to avoid viral multiplication and mutation. The virus tend to undergo because HIV is very good in multiplication and mutation. So if I HIV patient, you can manage your health. You can be healthy by sticking to your medication. Do not miss your medication according to how it is prescribed. Follow it. Thank you for listening. See you next time.